Good afternoon, this is Dr. Do again. This video is on alphabetic list problem, still on letter E. Today I'm going to talk about eating disorder, probably the last problem I can think related to this letter E. First of all, is there any situation related to the eating disorder that need to see the emergency situation? Yes. There is a condition called anorexia nervosa, which means just not eating, not have appetite to eat. If this going on for a while and body weight, basal body mass index really low, and with other symptoms like altered mental status or so that's kind of a situation need to see the emergency room to replace the nutrition and also the electrolytes and to treat as soon as possible. So this is the emergency situation. What are anything you can manage at home? Not really, unless you have confirmed or checked with your physician and under the medical guidance, because eating disorder can be very serious. I'm going to talk about three major problems quite commonly seen or quite commonly discussed. First one is the one I just mentioned, the anorexia nervosa. The second one is bulimia nervosa, and also the binge. So these are three categories. They usually happen in young female, with the sense of afraid of gaining weight, especially the anorexia. This group of people, it could be high socioeconomic status, could be middle, could be low, anybody. So typically, the prominent symptom is just not eating well, and lose body weight very low. Like we know the BMI is to measure the weight, ideal weight, and also if lower than 19, that is quite dangerous. And some of those patient can much lower than that, so that's really increase the risk of electrolyte imbalance, heart problem. So that's why the first thing I mentioned is after this long term of the anorexia nervosa has the altered mental status or heart beat irregularly, so that's very dangerous, so it has to go to the emergency. So basically, these patients just not intake of enough nutrition, including the macro elements, protein, and also the lipid and carbohydrates. So basically, if I think if you recall, or if you follow my other videos, the energy resource, we have the three major organic compounds, either carbohydrates or the lipids or the protein. And we talk about that from the diet, we take the three of these major compound and then digest, and to reabsorb and then to store them. If, for example, if the carbohydrates too much, store them as the glycogen, and if beyond that storage, then will become the lipid or fat to deposit. So when we need energy expenditure, then those stored glycogen or lipid or fat will provide when we're not eating. So this expenditure is a continuously process. Whether you're doing exercise or you're not doing exercise, we consume the energy. The body consumes energy for the cell, for the function anyway, so it's a consistent process. But for those anorexia nervosa or any other eating disorder patients, they do not have this intake. So then the energy comes from the fat, the stored fat or glycogen, and after that will be the protein. So basically these people start to use their own protein, almost use all the fat, like subcutaneous fat is almost none. And also, so where does the energy come from? The protein. So that's quite dangerous if people start to use self protein as the energy. That's quite dangerous. So these patients need to be managed. At least, even though it's not situation warranting emergency, still need to be pretty much. They need to be hospitalized, and to have multiple physicians on team. Psychological counseling and medical management, especially after the medical condition is stabilized, the psychological team or psychiatric team will be on board to do the behavior or cognitive therapy. So this is the anorexia nervosa. There, the bulimia nervosa situation is similar. But these patients has constantly binge. They binge, they do not eat for a cluster of time, and then they binge eat for a cluster of time. So after the binge eating, continuously binge, feel guilty about it, and have to, and fear to gain weight, so have to induce the, for example, use some laxative or induce vomiting with hands. And so those patients, those people usually can have that kind of sign. You can see either the teeth was damaged, or the finger, probably because of this process, use the finger to stimulate the post of the pharynx and causing that vomiting process. So this patient is also need to be managed by the in addition to medical correction, if there's some problem related to the nutrition or electrolytes, at the same time psychological counseling, psychological management is also very critical, either cognitive or behavior. Probably one is better than another. It depends on the situation. Usually it's the cognitive counseling is better, just to change the view of about eating and healthy diet, also the healthy eating habits. So this is another one. The binge is the occasional binge. It's not always, but these people again occur in young person and feel guilt to eat too much. So usually just eat occasionally, start to binge, and without other people to see it, so hide the food somewhere, and when it's not, nobody's watching, they start to eat. So these eat a lot. So that's kind of another disease. So these are the eating disorders. They are quite common. Depends on the class. Usually they occur on the high socioeconomic status class. They just afraid to look bad because it's not they want to maintain a perfect body shape, and so these are the most important thing about this eating disorder is, and or the most serious complication is to the heart and to the brain. If the nerve cells did not get enough energy or nutrition, or the heart, which induce which caused by the imbalance of the ions, caused arrhythmia. These two are the most dangerous complications for these eating disorders. There's some other kind of eating disorders, but I think these three are the most common and also the most dangerous eating disorder. So I just put here. You probably already know, but this is usually not just a medical issue, it's a psychological. So probably it's also a lot of behavior or social. So a lot of people might know this. But anyways, if you know somebody had this, or if you yourself have this, or if you have this thought, or if you know somebody had the similar thought, afraid to gain weight, do not eat too much. Just pay attention and be a help or remind. Just once a while, kindly remind. Do not forget to eat. That's probably. I don't think it will change anything, but just hope. With the hope, can at least do what we can. So this is the video for eating disorder. Very not deep in the medical concept, but just general. I hope it helps, and thank you for watching. I will see you next time.